Hello, my name is Katie Weber with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to talk to you about a test called a mammogram, which is a test to look for breast cancer. Breast cancer is one of the most common cancers in women. About 1 out of every 8 women will get breast cancer. A mammogram is a test that uses X-ray pictures to find a small breast cancer before a woman can feel it. When we find breast cancer early, it is easier for doctors to make it go away. Your doctor should help you decide when to start getting this test. Most women start at age 40 and get a new test every 1 to 2 years until age 74. Make sure you tell your doctor if any women in your family have had breast cancer. This might change when you should start getting mammograms. Changes in your breast, like a new lump or skin redness with swelling, are also reasons to get a mammogram. Most women have a normal test. Only 2 to 4 out of 1,000 mammograms find breast cancer. You can bring someone to support or help you on the day of your test. Usually, you will have to go into the X-ray room on your own. If you think you may have trouble doing the test, talk to the X-ray team at the time you schedule your visit. Talk about what kind of help you think you will need. It is a good idea to schedule the test at a time in the month away from your period so that your breasts are not tender. On the day of your mammogram, clean your body. Do not put on deodorant, perfume, powder, lotion, or ointments. These things can mess up the pictures of your breasts. You will need to take off your shirt and bra for the test. You will be able to keep your pants or skirt on. On the day of your appointment, go to the X-ray or radiology department. Check in at the front desk. Then wait in the waiting room until the person who does the test calls you. This person is called a mammographer or an X-ray tech. The tech will bring you to a changing room and give you a gown. Take off your shirt and bra and leave them in the changing room. If you wore deodorant or other skin products, wash them off with a cleaning wipe. Put the gown on so that it opens in the front. Once you are changed, the tech will bring you to the X-ray room. He or she will ask you questions about your health, like, who is your primary care doctor? Do you smoke cigarettes? What is your ethnicity? Are you an Ashkenazi Jew? What is your height? What is your weight? How old were you when your period started? When was your last period? Have you stopped having periods? Have you had a hysterectomy? Are you pregnant? Have you had children? How old were you when you had your first child? Did you breastfeed? Do you take any hormone medications? Have you taken these before? Has anyone in your family had breast cancer? Is this person a blood relative? Have you had any problems with your breasts? Have you felt any lumps in your breasts? Have you had a mammogram before? Where was that test done? Have you had a surgery or biopsy of your breasts? You may want to write down the answers to these questions before your visit and bring it with you. You can also ask your support person to help you talk to the tech. Next, the tech will guide you to the X-ray machine. You will open your gown on one side. Then you will rest one breast on a shelf on the machine. The tech will adjust your position and the machine. Your arms will hug the machine. A second shelf will lower onto the top of your breast. The 2 shelves will flatten your breast. This helps get the best picture of your breast. It will feel like a tight squeeze. You have to stay still and hold your breath. The tech will tell you when to hold your breath and when you can breathe again. The machine will stop pressure after the picture. The tech will leave the room or step behind a shield for a few seconds to take the picture of your breast and then come back. He or she will change the position of the machine. You will put your breast back on the shelf for another picture of your breast. After 2 pictures of your first breast, the tech will help you do the same thing for your second breast. It takes less than 10 minutes to take all the pictures. Usually, the mammogram is over now. Sometimes there may be a reason that the tech needs another picture or an ultrasound with a different machine that looks like a wand. They do this if they want a special look at one area of your breast. After the pictures are done, you will go back to the changing room. Take off the gown and leave it in the changing room. Put your clothes back on and get ready to go home. A doctor called a radiologist will look at the pictures. The doctor writes a report to say if your breasts look normal. The report is put in a computer. The radiologist also sends the report to your primary care doctor. It can take about a week for you to get your results. You may get a phone call, letter, or a portal message with your results. If it is normal, your doctor will help you plan when to get the next test done again. About 1 out of every 10 women will have an abnormal mammogram. This does not mean you have cancer. They may have found a cyst or other type of lump that isn't cancer. If your mammogram is not normal, you may have to go back for extra pictures of your breasts. You may also get an appointment to see a breast specialist to talk about your results. A small number of women will need a biopsy, which is a small surgery to test a piece of the breast to see if it is okay. If you have more questions about your breast health, talk to your doctor. Thank you for watching. I hope this video helps you feel ready for a mammogram. For more videos and other ideas for being healthy, please visit our website, forourhealth.org.